He was referred to us because the owners had noticed that he had been a little bit lethargic lately, not eating as much, just not himself. He went to his regular veterinarian where they did x-rays and an ultrasound and found that he had an obstruction in his kidney. The obstruction that he had was in what's called the ureter, and the ureter is the connection between the kidney and the bladder. So it goes kidney, tube, which is the ureter, then the bladder, and then urine goes into the outside world after that. And he had stones that were lined up along his ureter and preventing urine from flowing from his kidney into his bladder. If anybody's ever had kidney stones, you know they can be quite painful, and this was no different for him. So when he came to us, we reviewed all of his results and saw his ultrasound and noticed that his kidney was extremely dilated, and without the urine being able to pass through, the back pressure of that blocked urine was slowly killing his kidney.
And so what we did was we went in and we placed this slick little stent from the kidney down the ureter into the urinary bladder. And so this stent allows urine to kind of pass by those stones that were obstructing the flow of urine from the kidney into the urinary bladder. And that alleviates the obstruction and allows the urine to flow. And by doing so, we get to save a kidney, which is super cool.
What we would traditionally do is cut open the ureter and remove the stones and then sew the ureter back up. The ureter is about as thin as a piece of tissue paper, so it's very fragile, and it's very temperamental. So a lot of dogs who have surgery on their ureters can end up with what we call strictures, where it fibroses down, and then even though you've removed the stones, they end up with the same problem where they have backflow of urine into their kidney and they act like they're obstructed again. So what this does is it makes it so that we can actually relieve the obstruction in the kidney without having to do surgery on the ureter, or microsurgery basically on the ureter, and prevent those strictures from happening. We don't have to open the ureter at all. So it's a lot more effective, and it's a lot easier, quite frankly.
Easier is helpful, especially when you're working on tissue that's super tiny, like Dr. Hammer said. It's really hard to do a ureteral surgery. This surgery is really slick. It is allows for a very quick recovery, and doing anything minimally invasive is the way to go. That's how medicine is moving and surgery is moving. And so when we can help our patients through a minimally invasive approach, such as placing a ureteral stent and not having to make large incisions and incisions into tissues that may have a hard time healing, that's definitely the approach that we like to take as surgeons.
We saw Timothy the other day on recheck exam. We rechecked his stent, we rechecked his kidney. He's doing great. His kidney's no longer dilated, and he's feeling a lot better.
What's nice about these stents is they stay in long term and we don't have to remove them. Usually our patients do really well as long as we can get the stent in and establish urine flow.
We see a really quick turnaround, so we can take a dog who can't breathe and we can help them breathe better, and it's instantaneous. We can take a dog who can't urinate and can't pass any urine and help them urinate better. We can take a dog who feels pretty crummy and place this stent, and then all of a sudden, you know, really quite quickly they recover and feel great, and it feels good because we're not having to cut anything out. We're able to preserve, the function of these organs and give these guys a longer life. And that's what, our goal is always to give good quality of life and longer life. And we're able to do that. So it feels great.